With me, Kendall Burton. We have two very special guests in studio with us this evening in the persons of Dr. Andre Matthew and Mr. Alfred Alcide, attorney at law, and we'll be discussing the decriminalization of marijuana, a very interesting, very hot topic making the media circuits over the last few weeks. Gentlemen, welcome to Newsmaker Live. Thank you very much for joining us.
Thank you for having me.
Thank you, sir.
Let's jump right into it. First of all, let's get your opinions. Where do you stand, starting with you, Mr. Alcide, on the decriminalization of marijuana for medical purposes initially?
Yes. Medical purposes, they have countless number of reasons why those concerned, I'm going to say those in authority, those who are in charge of our legislation should take the necessary step, because we have circumstances where there are proof that taking cannabis, marijuana, call it marijuana if you want, do have medical benefits. And I can give you a very clear-cut example of people who have MS, multiple sclerosis, and I've seen documentary where they tell you that they will take all the tablets, they get a little ease up for a few minutes, half an hour. If they smoke one joint, they're all right for the whole day. We have instances of people who have asthma, and it has been proven that cannabis is good for asthma, and I will leave that for the medical doctor. But I do not see any reason why those in authority should not consider. I'm saying consider, but this is not something you can just do. You must have discussion, and for among those who are concerned, people who have done research, and then, but my personal view is I do not see anything wrong in decriminalize it for medical purposes, for starters.
Okay. And you, Dr. Matthew, where do you stand on the issue?
Well, I think I definitely want to start with what Counsel Alcide said at the end there. I think it's most important to try to bring together anyone who is of significance, of relevance, where this issue is concerned, before anybody tries to give guidance to where it should go. We need to get together a team of doctors, of lawyers, of police officers, representatives of government, people who would together pull their experiences and can give better guidance to what's happening locally. I think we need to be careful not to rush to thinking that what would have been the case in other countries would apply to St. Lucia. Now, coming more specifically to what I think as a medical practitioner of cannabis and its possibility to be decriminalized. Listen, there's a part to cannabis that we cannot forget, and that's where I really want to start. If you think about cannabis, it's actually right now a Schedule 1 drug according to the Drug Enforcement Agency of the United States. A Schedule 1 drug is actually a drug which is considered of high potential for abuse, high potential for addiction, and which is not considered at the moment, to be of any medical use. Now, why would the DEA decide that cannabis should be Schedule 1? I don't think that's a fight down on cannabis, and I'll try to explain. Cannabis is considered a psychoactive drug. Its psychoactive nature means that when you smoke or you ingest the substances, the compounds contained in cannabis, it goes into your bloodstream. It then passes the blood-brain barrier, ends up in the brain, and is able to attach itself to the cannabinoid receptors in the brain. Okay, so we refer to THC, which is also called delta 9 tetra hydrocannabinoid. We refer to THC as being that component of the cannabis plant which has the psychoactive properties. Now, its psychoactive properties are such that this is a substance which is able to affect one's cognition, And when we say cognition, we mean your thinking, you know, your ability to learn, your ability to understand. It affects your emotions and ultimately will affect your behavior. Now, I'm going to speed along here because I know we need to discuss this not only in the purely medical sense, but because of the way it acts on the central nervous system, because of its widespread action on the cortex, the basal ganglia, the hippocampus, areas which we call the limbic system and which control all those things I just mentioned, would it be mood or cognition. What cannabis can do is give what we've experienced as 8 different affections on the mental function. So we say cannabis can cause what we call cannabis intoxication. I'm going to mention them quickly. Cannabis intoxication, which is what, you know, most people are familiar with: the red eye, the dry mouth, the increased appetite, the slowness, the anxiety, the euphoria, these things. It can also cause cannabis dependency, or before dependency, cannabis abuse, where somebody starts to use cannabis and they find themselves needing more and more of it. So there they are, making cannabis the primary thing in their life. Like some people say, cannabis becomes number one, and then they drop out of life otherwise. So that's all they know. And then there's cannabis dependency, which is when they actually become physiologically and physically dependent on it. They need it, their body incorporates the THC and they need it for their survival, basically, for their functioning. Then there's actually cannabis intoxication or delirium. Now I'm going to give you a little story here. I remember about, anecdote to be more precise, I remember about 4 years ago, probably even more, I had a little cousin here who lived in the Denry area. And I was telling him about cannabis and telling him to be careful. I was telling him about the potential of cannabis to cause psychosis, to cause delirium. And he, interestingly, he was probably just about 15 years. And he gave me his experience, what he had heard had happened to somebody. He said this person went up into the hills to smoke cannabis. And when they'd finished smoking the cannabis, they were basically seeing the trees as police officers. So there they were darting through the trees as if they were running from police officers, you know, saying it's police. That is actually what we call cannabis-induced psychosis, which it can do. Cannabis can cause you to hallucinate. Cannabis can cause you to lose contact with reality. Somebody who smokes cannabis can end up having delusions. They have false beliefs. Then we say cannabis can also induce anxiety. Cannabis can cause panic attacks. And then there are a whole bunch of other conditions which is subclassified as class 8. Now, when as a medical practitioner, you think about a substance which has the potential to do any of those 8, you're already going to hold back. And I think it's why, you know, in the US, it would have been classified or scheduled as a class 1 drug. Now, all that said, really, I started by saying this so that people would understand why we take cannabis so seriously as medical practitioners, and there's a hands-off sort of approach. All that said, though, we have come to recognize, because of multiple studies, that there may be medicinal benefits of cannabis. And I just give another anecdote quickly, which I would say was my Sanjay Gupta moment. You know, Sanjay Gupta had a switch in how he saw cannabis. I went to do a house visit for a gentleman who was in his late 40s, very good friend of mine. Really, he's my patient, but a good friend of mine. At that point, he was terminally ill with cancer. And at the end of the visit, you know, my conclusion was that this gentleman is going to die very soon, probably the following day, maximum 48 hours. And I remember him being in a lot of pain, despite the medications we were giving him. I remember him having no appetite. I remember him being in a mess emotionally. And at the end of the visit, he looked at me and he asked me, Doc, what would you tell me to do right now? What would be your advice to me? And honestly, I could tell you, I looked at him and I was looking in his eyes and I'm saying to myself, I really wish I could tell you to smoke some cannabis at this point. Maybe it might be the only thing to help you. At that point, because of the research that I had come across, that cannabis can help appetite, can help pain in cancer patients, can help with mood, for me it might have been the only thing that might have helped it. That was the first time I'd ever thought of cannabis in that way, but it was something that happened because of my experience with him. He actually died the following day, and it always remained in my mind that, you know, I wish there was a possibility that if cannabis would have worked, he would have gotten a chance to use something that would have worked for him. So that was my eye-opening moment about the possibility of cannabis as a medicine. And from that moment, I've done my bit of research as to where else it could have been used. Sanjay Gupta's documentary speaks a lot about certain cases. There's a child who had a seizure disorder, which meant that she was having conversions up to 300 a week. It was cannabis which was able to bring it down to 1 a week. She was going to die, basically. And her life was saved because of it. Now, I started off talking about THC, and I'm just going to say, in the cannabis plant, there's another compound that medically we're looking at very closely, which is called CBD for short, which is cannabidiol. Cannabidiol. Cannabidiol is considered a more medicinal component actually than THC, because cannabidiol has an effect on the nervous system, it causes it to relax. So it will treat anxiety. It will tend to treat any condition where people have spasms. Counselor Alcide initially at the start of the program mentioned multiple sclerosis. These people tend to become very rigid, and it impairs their ability to move. You know, apart from their weakness, the muscle, the loss of power, they tend to have difficulty with movements because they become very rigid. So it has been said that cannabis could help in those cases as well. Now, you know, yes, there are studies which say they can. Would it be applicable to our situation here in St. Lucia? That's something that we would need to look at. What medical conditions are we having difficulty treating? We talk about asthma. I can say as a practitioner who works in an emergency room, maybe cannabis would be good for asthma, but at the moment it would not be something that I would look for, because I can effectively and successfully treat an asthma attack in 99% of the cases, I would say, with what I have in the ER at present, with very little worry about adverse effects. So would I need to push for cannabis decriminalized for asthma? I wouldn't. But there are conditions where yes, we would stop and listen, like the ones I mentioned earlier on, the neurologic condition.
But a lot of what you've said, you've used the words may, could, potential.
Right.
Yes.
What that says to me is that it doesn't apply across the board. There's also, as you indicated toward the end of your discourse, the potential for some benefit as well.
Right.
Right. So the fact that it has the potential doesn't mean that we should disregard it altogether. Yes or no?
I would say definitely not. In fact, Doc, I want to take on the point you just made there.
Right.
Yes, you can treat 99.9% of any asthmatic attack, but you are going to provide them with relief just for that moment after they have the attack. But whatever treatment you're giving them, can this cure the asthma? That is the big question. Can it really eliminate the asthma that these people suffer from on a daily basis? And I know practical example of a young man, schoolboy, a long time ago. He was getting fits every day. And his big brother, who used to be a smoker, he said, "Let me see." He said, "Come, Gasa. I'm going to make you start to smoke this thing there." And he's in his 50s. He never had another attack of asthma.
Right.
He's in his 50s now, and he's still smoking.
Right.
But then again, that's one isolated case.
Yes,
Now,
I
from a
understand
medical
that.
perspective,
I understand that.
can an experience like that be applied to every other sufferer of asthma, or are there risk factors that would they would be exposed to?
Right. So definitely, as counsel mentions there, if you have a case of asthma where you can't find anything else to treat it appropriately, maybe I would consider cannabis. But remember, again, what we're saying is, and you hear me saying a lot of maybes, because this is not definite. There is not enough medical experience. Yes, there might be research, but still, as doctors, you know, we don't jump on every research result that comes out.
Right.
We tend to wait a lot for clinical experience for us to get confidence that something is not only effective but much more importantly safe.
Right.
Now, if you're thinking about somebody with asthma, what I would say is, for now, we can treat asthma safely. What would happen if I was to introduce an 11-year-old potentially introduce an 11-year-old to cannabis to treat her or his asthma, but end up affecting his mental function. There have been studies to show clearly that cannabis, especially used in children, can end up decreasing the intelligence quotient. The IQ tends to decrease. Would I want to risk, as a medical practitioner, decreasing somebody's ability to learn for me to treat their asthma when I have safer options? It's all really about options which are safer versus options which you don't know potential, and it happens with the other medications that we use. I mean, let me give you examples of some terrible examples. There might be gentlemen who are hypertensive and use Bezide or use atenolol for their high blood pressure and might be having erectile problems. That's something that might happen. It's a potential side effect. I mean, I don't give gentlemen those drugs because of the potential at all, but it is something that would not necessarily happen to everybody. So there may be people who use cannabis. You know, we say only 1 out of 11 people who use cannabis end up having an addiction. There may be people who use it who end up having no problem. But what we look at is the potential. And again, I'm saying this is something which has been classified very well in terms of the reactions that might happen on the mind. All 8 possibilities, and none of them are beautiful. So you really want to be careful if at all you're going to use it. Now, what has happened a lot, and I'm sure, you know, if you've read the research, you would gain a little bit more confidence because of the fact that they've started to scientifically quantify a lot more of the medicinal marijuana. So if you quantify it properly, it may become possible for you to avoid the adverse reactions of the cannabis while getting the benefits.
And that is an issue I want to raise with Mr. Alcide specifically from a legal perspective. All of those arguments that we've heard from the doctor and to an extent yourself, aren't those enough for us to consider going that route of decriminalizing first of all, not going as far as legalizing, but decriminalizing first of all, if purely for reasons of making it more easily accessible for persons suffering from those conditions who could benefit from that step of decriminalizing the cannabis?
Yes, I would agree with that. I would agree with that statement in the sense that, but I'm still going to say whatever step the authority, those who are in authority, because you don't just decriminalize by just walking down the street. There are people who are in charge of the state, and I keep on saying those in authority, who have the responsibility to determine whether they should take a certain step as to whether it should be decriminalized or not. You have to be very careful. Now, if it's a situation where we're talking about decriminalize just for the purpose of medical reasons, then I do not see anything wrong in having some discourse on the issue. But you have to understand that there are people who, I'm not going to say depend on cannabis, but this is part of their ritual. Just like you have certain Indian nations who smoke hemp. Now, that's not illegal to smoke hemp, because I was in London. You walk down certain streets in London and you see men sit by the road, they smoke the hemp in their chalice. That's not illegal. I'm saying if you're going to decriminalize solely for the purpose of medicine, then you need to take a further step. You need to consider people. I'm not saying decriminalize so that every young child can get involved in smoking cannabis, but we are talking about certain people. I'm going to be specific now. We have Rastamen who smoking marijuana is part and parcel of their whole religious ritual. Just like you have the priest, the Catholic priest, going in a church on the altar and having this smoke and they drink the wine. When Rastaman chant, when Rastaman pray, and they say, they praise Selassie, this is part and parcel of their entire ritual. Now, if those in authority wants to take the step in considering decriminalize for the sake of medicine, then obviously you're going to have certain other factions of the society going to say, wait a minute, but you decriminalize for the sake of medicine, I can use that as an excuse to smoke. But I'm saying that it needs to go one step further, not just for medicine. But yes, it is a step-by-step process. You decriminalize for medicinal purposes, but then you also have to recognize that there are factions of the society who, that becomes part of their daily life. Because one of the things that really disturbs me greatly, I'm an attorney, I'm in court practically every day. When you see an elder Rastaman end up in court because police officer decide to search their home, find, maybe for the purpose of looking for firearms, they find a little 5-bag, a little spliff, and they arrest a Rastaman for that. This doesn't even happen in the UK, and we are supposed to be. Our whole system is a transplantation of the English system. They don't arrest anybody in the UK for a spliff or 5-bag. But you have elderly Rastamen. We're talking about the first set of men who are in their 60s, and you come to their home, search for firearm, whatever the case, you find a spliff, and you arrest them, you drag them in the cell, you lock them for 3 days, but take them before court of law.
Rastamen aside, one of the arguments put forward for the decriminalization of marijuana is that it would free up the judicial system.
Yeah.
The court system, free up the prisons. If you put in place regulations or laws that say if you're caught with a certain amount, you're going to be charged a fine or some other sort of punishment as opposed to imprisonment.
Yes.
But I want to get from you, what would it take legally now to move from this current situation to perhaps your ideal, where Rastamen and persons with medical conditions that require the cannabis can do so freely?
Now, don't forget, at this point in time, when government pass a piece of legislation, they pass it because there is a mischief affecting the society. That's why they pass drug laws. Because they associate drugs with killings and bad behavior. So obviously you have, all over the world, you have legislation dealing with people who traffic, who use drugs. I don't have a problem with that. Now, the point I want to put forward is that those in authority can take this a bit further, in the sense that you don't have to clog up the legal system with petty instances of maybe, I'm saying maybe particularly an elderly, a grown-up man, and drag them in court for a small quantity of marijuana. And our legislation is such that they consider, if you are charged with possession, that's you are in possession of the cannabis, then they can lay another charge on you, possession with intent to supply.
Right.
Now, to be charged with possession with intent to supply, anything above 4.5 grams, 45 grams, 45 grams, that's intent to supply. 45 grams for an elderly Rastaman is a small amount of herb. Now, when you drag this man in court, and there's a possibility a fine might be imposed, and he may not be in the position to pay the fine now. What's going to happen if he can't pay the fine?
Right.
Now, I'm saying government can move away from this. They can move away from this, and they can enact legislation to minimize that clogging up of that system. We go to court every day, and I know those concerned don't involved in judiciary will be watching this program, and I'm not there saying that police should not arrest people for cannabis. I'm not saying that at all, but we have to understand we live in a society where so many of the young people in the society don't have a job. The society have nothing to offer them as far as employment is concerned. What do? They get up in the morning, meet the guys by the block, smoke a little spliff. They're not hurting anybody. I'm saying, if this is the case, why should we go to these guys, arrest them, take them before a court of law, terrorize them basically? I'm saying we can find a different way.
And they're still not being productive.
Yes, they're still not going to be productive. Right. Exactly. We can find a different way. I am not saying I have the solution, but I'm certain if people have discourse on the issue, they'll find solution.
Let's have a little more discourse. We can get from either side. What are some of the checks and balances that we can put in place if we go that route of decriminalizing to ensure that there's not the abuse that currently exists?
Is an abuse that exists?
Either of you?
I'm not sure whether I am going to accept that statement about the abuse that exists. What abuse? The abuse? You mean you call somebody who smoke a little bit of cannabis that they're abusing cannabis? I don't
No,
see.
I'm going along with the doctor's earlier statements regarding the possible effects. Right? I mean, abuse can apply to any substance.
Yeah. Okay.
Right?
Fair
Let's be clear on that.
Yes.
All
Fair
right.
enough.
And speaking of abuse, Doc, earlier we were talking about the THC in marijuana, and we've quoted a number of research projects and the like. Some of those same research surveys have found that cannabis is a lot safer than tobacco and alcohol, which we allow legally to be consumed, to be sold. How then do you explain that?
Right. So I think what we need to, when you think about cannabis, and which is the way most medical practitioners will I think would have cannabis appear in their head right away. Cannabis is dangerous because of its effect on the mind and the potential for psychosis, for delirium, for it to become a chronic problem with abuse and addiction. Anytime you think about a problem that might affect somebody mentally, as a medical practitioner, you really want to stay away from there.
And you think alcohol and tobacco don't have those?
Alcohol and tobacco do have tendencies to lead to addiction as well.
Right.
Tendency?
Definitely, and actually you have a greater number of people who are actually addicts of tobacco.
But is it concerned about the psychosis exclusively?
Exactly.
Okay.
Because the deleterious effect on the mind that cannabis would have is not similar in any way to what tobacco would have on the mind.
I agree with that.
So, that's where we need to really be careful. And I would say, especially to the young men, yes, it's true that the economy is bad. Yes, it's true that they don't have employment as they would need it. But the last thing you want to end up doing is playing around with your mind, because if tomorrow the economy gets better, you need your mental function to be a part of
But Doc,
the improvement.
Doc, let me ask you something. Doc, do we have any factual evidence that young men who smoke cannabis tend to go off their head? Do we have now I'm not talking about a temporary situation. We're talking about that the mere fact they indulge maybe on a daily basis in smoking cannabis, and I hate to use the word marijuana, cannabis. Do we have any statistics to show that they are prone to become mentally ill in the future? I don't think they have any statistics to that effect. And my belief, I'm not a medical practitioner,
Right.
my belief, that's my belief, is prone to any objection by anybody. My belief is, if you smoke cannabis and for some reason you go off the rail, I honestly believe this is inherent, and with the cannabis or without the cannabis, if you have at some point in your life to become mentally ill, you will.
Yeah, but isn't that established that
Yes,
those dangers exist because you have a pre-existing condition that
That's the point
predisposes
I'm
you
making.
to
Right.
that?
So
That's the point I'm making.
why we've not been able to, in the case of the chronic psychoses like schizophrenia, say for sure that somebody who used cannabis ended up developing schizophrenia because of the cannabis solely, is because schizophrenia inherently is a multifactorial condition.
Thank you.
But at the same time, it's important to keep in mind that depending on exposures that someone might have, depending on traumatic experiences, depending on exposures to certain drugs, to certain substances, it can actually trigger somebody who up to the moment was functioning normally to end up being schizophrenic.
Yeah.
So, and there has been definitely counsel, there has been an association between the use of cannabis and chronic psychosis.
No, I accept that. But maybe it is because it is inherent in that person, and what the cannabis does, it punctuates it.
Right. Well,
That's my belief. It punctuates whatever which is inherent of that person. Smoking it, obviously, it just blows it out and the person end up being mentally affected.
Right. So
Okay, we'll hold that thought. We're due for a break. We'll take that break, and when we come back, we'll continue our discussion with Dr. Andre Matthew and attorney at law, Mr. Alfred Alexis. We'll be right back.
Alfie.